Today, we're going to uncover the genetic story behind Fowler's syndrome. It's a rare condition, but it's one where a single, tiny error in the genetic code leads to absolutely devastating consequences for a developing brain, even before a child is born.
It's a really profound question, right? And it gets right to the heart of what we're talking about today. We're not talking about a minor glitch here. This is a fundamental breakdown in the very earliest stages of life, and the consequences, they're visible long before birth.
So, to be clear, what exactly is Fowler syndrome? Well, it's an inherited genetic disorder, and the two words you really need to hang on to are severe and before birth. This isn't something that develops over time after a child is born. The damage happens right there during pregnancy, leading to these profound, widespread issues in the brain's actual structure.
So how in the world do doctors even begin to uncover something this rare? The story, it almost always begins in a quiet, dark room with a shadow on an ultrasound scan. The very first hints might show up about midway through a pregnancy, during a routine check. But the truly defining, unmistakable features, they often become undeniable later on, somewhere between 26 and 33 weeks. And here's the key word. The condition is progressive. The problems don't just appear, they actively get worse during this incredibly critical window of development.
So what are they actually seeing on that scan? Well, it's this cascade of developmental failures. The cerebral hemispheres, the big, wrinkled parts of the brain we all picture, they're often almost completely gone. And in their place, sonographers see these large cavities just filled with fluid. It's a devastating combination that has a specific medical name, hydranencephaly-hydrocephaly. Seeing these changes on a scan immediately leads to the next urgent question, why? Why is this happening? So let's pivot from what can be seen on a scan to the molecular answer, the genetic root cause.
And here it is, it's so stark and specific. All of that widespread destruction, it all traces back to one single point of failure, a mutation in one gene called FLVCR2. It's just a powerful and heartbreaking example of how one tiny error in the code can have such catastrophic results.
So what's this gene supposed to do? Well, think of it like the manager of a vital supply line. The FLVCR2 gene's job is to build a special transporter protein. This protein delivers absolutely crucial nutrients, we're talking choline and ethanolamine, to the brain and placenta while they're growing at an incredible rate. But when there's a mutation, that supply line is just cut. The brain is literally starved of its most essential building blocks, and that's what leads to the tissue destruction.
Okay, so how does a child end up with this specific mutation? It's inherited in a pattern that geneticists call autosomal recessive. Now, that sounds complicated, but here's what it means. Both parents are what we call carriers. They each have one perfectly normal copy of the gene and one mutated copy. So they themselves are perfectly healthy. But for a child to develop Fowler syndrome, they have to inherit that one mutated copy from both mom and dad.
And this inheritance pattern leads us to a really crucial number. For a couple who are both carriers, with every single pregnancy, there's a 1 in 4 or 25% chance that the child will inherit both of those mutated copies and develop the syndrome. Understanding this number is just a critical piece of information for a family.
All right, so we have a suspicion from the ultrasound, and we understand the underlying genetics. So how do we put those two things together? How do doctors move from a possibility to a definitive, certain answer?
The path to a diagnosis is actually pretty logical. It all starts with those alarming findings on the ultrasound. Now, the specific pattern of brain damage isn't random. It strongly points towards a genetic cause like Fowler syndrome. And that suspicion leads to the crucial next step, genetic sequencing. By analyzing DNA, scientists can look directly at the FLVCR2 gene. If they find that mutation, well, the suspicion becomes a certainty.
Now, given that the prognosis is so incredibly severe, most infants don't survive for long, you might wonder, why does getting that specific genetic name, Fowler syndrome, why is that so important? The thing is, that knowledge is incredibly powerful.
Let's really explore that. Why go through all the trouble of genetic sequencing when the outcome is already known to be so grim? The answer, it turns out, lies in everything a diagnosis provides beyond the prognosis itself.
One of the most critical things a diagnosis does is provide differentiation. It gives clarity. A brain abnormality could be caused by lots of different things.
But a genetic test for FLVCR2 immediately and definitively separates Fowler syndrome from completely different conditions, things like Huntington's, which shows up in adulthood, or NF1. It provides absolute clarity and rules out a whole world of other possibilities.
So here's the bottom line. Getting a specific name changes everything for a family. It puts an end to what can be a painful, confusing diagnostic odyssey. It gives them a concrete answer. It confirms the prognosis, it explains that 25% recurrence risk with precision, and, so importantly, it opens the door to future reproductive options, things like prenatal testing in a future pregnancy. It confirms that this is hereditary, not just some random one-off event.
You know, the story of Fowler syndrome isn't just about one disease. It's really a window into the much broader effort to understand and decode all rare diseases.
So, what are the biggest takeaways here? Well, first, that a condition as devastating as Fowler syndrome can be traced back to a single gene, FLVCR2. Second, that genetic testing is what gives that definitive answer. And maybe most importantly, that diagnosis isn't just a label, it's a tool. It's a tool that gives families clarity and the power to make informed decisions for their future.
The research itself really says it best. The words they use, essential and definitive, they just underscore the clinical power of this knowledge. It's all about giving families the most accurate information possible during an impossibly difficult time, which allows for those crucial, necessary discussions about what comes next.
And that really leaves us with a final thought. This journey to understand Fowler syndrome, from a simple shadow on a scan all the way to a single gene, it shows us a path forward. And it really makes you wonder, doesn't it? How many other families right now are on that painful diagnostic odyssey for a condition that is just one single genetic key away from finally being understood?